Notice, challenge, and change. Those are the three basic elements of cognitive behavioral therapy. Today, I'd like to talk to you about that first element, noticing. My name is Thomas Brown. So as I've said in other videos that I've done, let's remember that these videos are not designed to replace professional therapy with a psychotherapist, social worker, or psychologist. If you're feeling overwhelmed and unsafe, please call 911 or go to your local emergency room to seek treatment and the services that you need. If you're feeling like you've got some big issues that you're trying to work through and it's feeling a bit beyond you, but you're feeling safe, it might be time to call a place like Qualia Counseling Services or another agency in your area to seek some professional help. However, if this is a problem that you sort of feel like you can manage on your own, it might be something that you want to buy a self-help book for, or watch this video, then this video is for you. Okay, with that being said, we have done quite a few videos already, and here today we're talking about noticing, challenging, and changing. In previous videos, we've talked about the cognitive model. We've talked about how that model applies to common problems. And then also in my most recent video, we talked about goals and defining the problem. So all of that is kind of set up for getting into the work of cognitive behavioral therapy with noticing, challenging, and changing. And today we're noticing. So what do I mean by noticing? Well, let me pull up my slides like I always do in these videos so that we can take a look at what I'm talking about here. So noticing. All right, here it is, notice, challenge, change. And we want to talk about this first step, which is noticing. So when we notice, we are paying close attention to the things in our life that's starting to that are kind of being bothersome, or the things that we have defined in our problem and defined in our goals that we want to pay attention to. So there it is, notice, it got bigger and we want to pay attention to it. What are we doing when we're noticing? Well, all sorts of things. We're wanting to kind of gather information about that problem. In kind of scientific terms, we're gathering data. Data, information, we're looking at it, we're observing it, we're trying to figure it out so that we can really understand how this thing is functioning at a really deep level, and then also understand what we're going to do about it. So we're gathering information about the problem itself. We're looking at maybe when thing happens, where it happens. Is it always that on Sunday night, just before I'm going to bed, I'm getting really anxious? Or is it that, whenever this person shows up in my life, then I start feeling this way. Or if I have to do a presentation at work, this is how this starts happening. So we want to look at the when, we want to look at the where. How often is it happening? Sometimes we feel like, we're sad all the time, but maybe it's actually only at certain points. How intense is it? We can do some noticing, some kind of gathering data where we're looking at a mood like sadness or anxiety, and we're rating it on a scale of 1 to 10. So that we're kind of noticing that, I'm not anxious at 100% all the time. I'm anxious on, like I said, Sunday nights, and I'm at a 7 or an 8 out of 10 most of the time. So it helps us to understand and see what's going on. What's going on, around us when these strong emotions or thoughts come. Remember, back to our very first video, we talked about the situation, and the story or the meaning that we're putting on the situation will be important to understand how we're feeling about it. So it might be that there are certain elements that are happening, certain things that are going on around us, certain people, certain requirements of us, certain stressors that are really activating this problem and making it come to life for us. What's the emotion? Sometimes it could be that we don't even know exactly how we're feeling, we just don't like it. So it might be that we start paying attention, noticing, and tracking emotions, just naming them. Similarly, taking a look at our body and getting connected to that, feeling what it feels like on a physical sense in our body so that we can start paying attention to that. What we're wanting to do is, as I've said already, gather information, gather data so that we really understand the problem clearly and see exactly where we need to make some changes, or what we say in therapy, to kind of intervene on it and do something about it. So those are the kind of things we're looking for. And there's all sorts of ways that we can set this up to pay attention and to notice. So one way is all the way back to that 5-factor model that we talked about, or the cognitive model back in earlier videos. We could take a look at this type of model or this type of worksheet and use that as a noticing tool. So anytime that we're feeling like our moods are shifting towards the negative, we could pull out a copy of this and track pen to paper what's happening in these various areas to understand what's going on. This is a great noticing tool. Another way that we could do it is something far more simple, and you could set up any kind of system, any kind of chart where you're taking note of the date, what's going on around me, how do I feel at the time, how strong was it, and maybe how did it end. That might be a good tracking tool, and you can make that more specific. You know, if you're really wanting to pay attention to that Sunday night feeling, you could start tracking, you know, when does it start, when does it end, how intense does it get, are there times when it's less intense or certain Sunday nights when it's not. So that again helps you to really understand and pinpoint what we need to do about this problem and how we're going to start changing it. So noticing, challenging, and changing. Those are those three basic elements in cognitive behavioral therapy. Today we talked about noticing. Sometimes we also talk about this as tracking or monitoring, but what it is, regardless of what you're naming it, this is about noticing information, gathering the data, writing it down pen to paper so that you can start really understanding and start intervening or making changes on the problem. Again, my name is Thomas Brown. I'm from Qualia Counseling Services. We've got a lot of information on our website, on our blog, on our Facebook page, and our other social media platforms. I invite you to visit those places if you're interested. If you want to know more about our services, give us a call and we'd be happy to talk to you about that. Take care. My name again is Thomas Brown from Qualia Counseling Services.